Hi, my name is Dr. Taylor Van Wyman. We're going to talk about metabolic testing, functional nutrition, and functional neurology for thyroid conditions. So all chronic health conditions have some common threads. Whether you're talking about thyroid conditions, diabetes, fibromyalgia, vertigo, chronic fatigue syndrome, peripheral neuropathy, they both have two components, both metabolic and neurologic. Now, metabolic imbalances could be things like anemia, unstable blood sugars, adrenal gland dysfunction, hidden infections, and then obviously neurological imbalances are decreased frequency of firing to the brain. So like I said, all cases are a combination of both neurological treatment and metabolic management. So if you're not doing both sides of the story, you're missing half of what's supposed to be taken care of through these issues. So what is metabolism? Metabolism is the food you eat, the things that you take in, is converted to energy. So when we're talking about the metabolic side, that's what we're talking about. Body systems, how they're converting things and how your body's using them. So 30% of your energy goes to what system? So we have endocrine, digestive, nervous, immune, and cardiovascular. So the answer is the nervous system. 30% of energy that your body produces, metabolism, goes to your nervous system, which is by far more than any other system in the body. So if you have a metabolic imbalance, the first system that's going to be affected and affected the most is the neurologic system. So you need proper functioning thyroid for proper metabolism and for a well-functioning brain, so that you can get the brain thyroid connection going through here, and it goes back and forth. So thyroid symptoms would be things like fatigue, increased weight, morning headaches, depression, constipation, overly sensitive to cold weather, poor circulation, muscle cramps. You get colds easily, your wounds heal slowly, you require excessive amount of sleep to function properly, digestive issues, itchy, dry skin, dry or brittle hair falls out easily, edema, which is also known as myxedema with thyroid issues, and loss of outside portion with the eyebrow. So the thyroid supports things like bone metabolism, the immune system, the brain system, fat burning, growth, sex hormones, everything. What you have is there's thyroid receptors on absolutely every cell in your body. What thyroid hormone does is it actually crosses the cell membrane, hooks onto the DNA, and turns on and off genes. Now every cell in your body has a nucleus and has that capability, so your thyroid gland, your thyroid hormone, works on every cell in the body. So we talk about thyroid crosstalk. We're talking about the main systems that your thyroid converses with and vice versa for functionality. Things like the immune system, the gut, the brain, and the endocrine system. So they all affect each other. So the thyroid affects the immune system, and the immune system affects the thyroid and its functionality as well. So what this diagram is showing here is that you have this basically thyroid function. So what we're looking at is and we'll go into this a little bit more later, is your hypothalamus, which is in your brain, releases thyrotropin releasing hormone. Thyrotropin releasing hormone goes to the pituitary gland. The pituitary gland releases a lot of different hormones, sex hormones, adrenal hormones, growth hormones. Obviously we're looking at the thyroid glands, we're talking about the thyroid hormones. It releases TSH, which goes to the pituitary, which says, hey, this thyroid stimulating hormone, we need more thyroid hormone. And then it releases T4 and T3. So 93% T4, 7% T3. So the problem with that is T4 is the inactive form of the hormone. T3 is the active form. So what T4 and T3 do is they jump on what's called thyroid binding globulin. We call it the taxi cab because it takes it different places in the body. So what happens is your T4, which is the inactive form of the hormone, jumps on thyroid binding globulin. And it goes to different places like the liver, the gut, and other tissues to be converted from T4 into T3. So once it goes into the active form, T3, then it can be used in the cells and it can activate, like say, the genes. You turn them on, turn them off, produce things that your body needs to function properly. So some thyroid basics, and this will kind of review things a little bit, is the hypothalamus sends a signal to the pituitary via thyrotropin releasing hormone. The pituitary gland sends a signal to the thyroid via TSH, or thyroid stimulating hormone. So TSH causes enzyme TPO to stimulate the release of T4 and T3. Like I say, these hormones ride the taxi cab, thyroid binding globulin, to different places in the body. In the liver, so this is important here, liver can basically, the T4 is converted to T3, so 60% of the 93% of the T4 is converted to T3 in the liver. So if you have poor liver function, it will cause poor T4 to T3 conversion. So if you can't make active thyroid hormone, which actually does most of the work, then yeah, you're going to have symptoms of low thyroid. So this is what we're going to start getting into as far as proper testing being needed so you can find these things out. 20% of that 93%, again, of the T4 is sent to the gut to be converted from T4 to T3. So poor gut flora will also cause poor conversion of T4 to T3. And there's other things in the gut as far as cofactors and enzymes that are needed for this conversion. So if these things are depleted as well from various different reasons, you also have poor conversion, which will make you have symptoms of low thyroid. And 20% of the free T4 is sent to peripheral tissues for conversion using 5-deiodinase enzyme. And a small percentage of T4 goes to reverse T3, which is sent back to the thyroid to be broken down. And that's a safety mechanism so that you don't have too much T3 in your system, because if you have too much T3, it can actually kill you. So have you been told your lab tests are normal? And almost every person that suffers from low thyroid, that we see at least, has been told, hey, all your labs are coming back normal, but your symptoms of low thyroid persist. You continue to have all the symptomatology that we already talked about. So the problem with lab reagents is they're inaccurate. They use bell curves. So what labs do is they independently lab test, and their lab values are different from different labs across the country. The reason being is lab values are based on patient population. So who's the most common person to go in and get labs? Sick people. So you might be the healthiest of the sick people and have really good labs compared to a bunch of other sick people, but that doesn't necessarily mean that you're functioning like you're supposed to or that you're experiencing true health. So functional lab values are more sensitive to reveal underlying problems, and that's what we use at our office with functional medicine. It's using actual functional ranges. So what is that? So here you have your lab values. So let's say from beginning of the red here to the end of red here is your normal lab range. Anything below that is abnormal. Anything above that is abnormal. So functional range is this here in blue. What that is, it's a smaller range where we look at it more specifically. So we'll say these are kind of like pre-disease states. So you've heard of pre-diabetes, pre-this, that, or the other, pre-hypertension, whatever. We'll say this is pre-disease state. So say the lab high right here is 31. Okay. You come in and your lab value is 30. And your medical doctor is going to say, you know, John Doe, your labs look great. There's nothing out of range. Everything seems normal. We don't know why anything's wrong with you. Go home. We don't know what to do. The problem is look at it functionally. You'll see, why wait until we're 1 point or 2 points above the abnormal range to actually consider it being disease or in a pre-disease state. If we can take care of things in this green area, keep them in the blue, we'll never get into those disease states. And that's what we're talking about with the functional ranges. So this is just an example of, let's look at TSH, which is a thyroid stimulating hormone, which if you have a thyroid issue, you've heard that a million times. It's not anything new as far as that's related. So the functional range is 1.8 to 3. Now the lab range can vary, like I say, it's typically 0.3 to 5.7. That's a really big margin, especially as far as TSH is concerned. That's huge. So if you're within these ranges, they're going to say you're normal. There's nothing wrong with you. Your thyroid's functioning like it's supposed to. Go home. Well, like say yours came back at 4.2. Lab range, you're okay. So to say that you have hypothyroidism legally, you have to be lab high. So you have to be above this 5.7. And your medical doctor will never tell you have a thyroid issue unless it is above that lab high. Well, we would look at this and we'd say, hey, your thyroid gland does not function like it's supposed to, at least within an optimal range, which can definitely give you symptoms of low thyroid. So we need to take a look at that, and we need to figure out why, because there's different places in the system. Like say if you're having a liver issue, so you can't convert T4 to T3 like you're supposed to. So an example of a liver issue could be something like a hidden infection in the liver, a liver fluke, or let's say you've been eating fortified bread for your whole life. What they do with fortified breads or cereals is they take actual rock iron, they crush it up, and they throw it in there and they say, hey, we fortified it with iron. That sounds like a good thing, right? Well, it's not, because your body doesn't use rock iron much at all. It's not the form of iron that your body would prefer. So what it does is it stores it up in the liver. So over a lifetime of eating fortified breads or cereals or products or whatever, your liver gets bound up, it gets clogged up with all this junk that it doesn't need or want. So then your liver function goes down. So then you can't convert T4 to T3 like you're supposed to. And we give a million examples like that. And here's the problem is there's no medical intervention for that. You go to your doctor and say, hey, I think my liver is functioning a little bit below optimal. What can you do for me? Say, well, we can't give you a med for that. We can't cut it out. They don't know what to do. So supporting it properly, nutritionally, making sure we know where the issues are in the system to get your thyroid hormone working like it's supposed to in your body will get you feeling better. It's about finding the underlying cause here, people. It's not about masking symptoms. It's not about giving you replacement for hormones, getting your body to work like it's supposed to so that you can function like you're supposed to and get out of here and live your life. Get your life back. So that's what we're looking at when we look at the functional range. And there's some other examples on there as well. So true thyroid functional test, like say TSH, which you've heard a million times, is conventionally ordered, and maybe like a free T4 typically might be ordered in there as well. But what you want is you want a total T4, you want a free thyroxine index, you want a free T4, you want a T3 uptake, you want a free T3, we're going to reverse T3, you want TPO and TBG antibodies to see if you're autoimmune. Thyroid, and then TSH antibodies, and TBG, which is thyroid binding globulin levels. So one thing that you should know, and this is through various studies that have been done, is that 90% of thyroid patients are autoimmune. So if you are hypothyroid and you're just being addressed with hormone therapy, you're missing half the battle right there. You're autoimmune. You need to be addressed as such. And we'll talk about that a little bit here as well. So a typical thyroid test, like say TSH, and typically like a total T4. So the question is, how can you manage health without all the information? How can you do a good job? So burning out the thyroid gland with hormone replacement is a 50-year-old model. And, you know, it's gone by its wayside. There's enough thyroid sufferers out there that this isn't news to. They've known this forever. They continue to have symptoms, continue to go in, continue to have fine lab ranges, or, hey, we need to adjust your synthroid or your, you know, whatever thyroid hormone they're on, Armor, whatever it is. Almost every time we take your TSH levels, because they're just going everywhere. Yeah, that's a symptom of a bigger issue, and giving hormone replacement might feel good in the short term, but long term it's not an answer. So in order to manage these health, you need to look at the causes of the problem, not just the symptoms, the underlying causes. So that's what we really look at with our functional medicine approach, is why is something happening? If you can figure out why is something happening, then you can properly support somebody to get it stopped. And that's what we're talking about. So Hashimoto's, thyroiditis, and Graves' disease. So these are autoimmune issues. So these are not thyroid problems. You know, and that's what we talk about as far as hypothyroidism, 90% being autoimmune. You can have different areas in the system having issue as well. But if you're not, like I say, being addressed immune system wise, it's a huge miss. So your immune system is mistakenly attacking your TPO or TBG in relation to Hashimoto's, or your TSH in relation to Graves' disease. So like I say, you're missing the issue because it's an immune problem. So there is an imbalance in your immune system that needs to be addressed. Like I say, proper testing, figure these things out so you can actually feel good. So the immune system has three parts. We're going to just talk about this autoimmunity just a little bit more to make it more sense how we look at it and what needs to be done. So your natural barriers would be like your skin, your lungs, your eyes, your gut flora, the acid in your stomach, mucus in the respiratory system, you know, the first line of defense through there. So, and then you have your Th1 and your Th2 white blood cells. So Th1 is what's called your innate immune response. These cells are in the front line of defense against antigens that come in. So antigen comes in your body. These are the cells that see them right away and eat them up and get rid of them. Then you have your Th2, also known as humoral immune response. So it's your adaptive immune system. Once an antigen comes in and your white blood cells see it, hit it with an antibody so your body can recognize it. These other cells get activated and they start to join in the fight and kill things that are marked with the antibody. And that's where we get in a little bit of trouble, is if things that aren't supposed to be marked with the antibody, like yourself, your thyroid gland, or your skin, or your pancreas, or causing autoimmune issues, causing diabetes or thyroid issue or scleroderma or lupus or whatever we're looking at. The third part we look at is the regulatory system, the Th3. So this balances the communication between the Th1 and the Th2 cells. So in most autoimmune patients, Th3 is failing and Th1 and Th2 come out of balance. So autoimmune disease. So there are two responses in your immune system, the Th1 and the Th2 like we're talking about. So when a person is autoimmune, one of these systems is hyperfiring or firing more than it should. It's dominating the other system. So balancing the system goes far in reducing a patient's symptoms. So if we can balance wherever that's going out of balance, like think of a seesaw, Th1 is way too high, we need to get that back down in regulation, or Th2 is way too high, we need to get that back where we need it, and balance the immune system and help the Th3. So what would trigger immune system to do such things? So things like dysregulation. The immune system is balanced because of stressors to it. Things that could be causing stress to the system, causing this dysregulation. Chronic inflammation, bad blood sugars, bad adrenal gland, hormone imbalances, neurological imbalances, pregnancy. I mean, you get a lot of thyroid and autoimmune things with pregnancy. Low vitamin D and increased acidity in the blood, like I say, just a few things. Or two, you could have active antigens. So immune system is imbalanced due to invader, also known as the antigen. So that'd be chronic infection, an infection in the gut. These could be hidden infections. You might just feel fine. You might not feel like there's anything wrong with you, but you have some kind of hidden infection brewing in your system. Food sensitivity. So we do food sensitivity testing to see how your body reacts to specific things. Because if they're constantly aggravating your immune system, they're constantly throwing this out of balance. Environmental toxins and leaky gut syndrome. And leaky gut syndrome is a huge issue. You should Google that. We don't have enough time to talk about that here, but it's a huge issue as far as all this is concerned. So, like I say, proper testing is what's needed to figure out exactly why you're having the issues that you're having, so we can get things working like they're supposed to, so you can feel well. So management and support for things like Hashimotos and Graves, you want to remove the antigens that are causing the dysregulation. I mean, it makes sense, right? If we can figure out what's affecting the system negatively, and we can take those out, we say, hey, Julie, corn, your body is very affected by it. Checking the IgG, IgA immune system markers, they react heavily to that. You need to take that out of your diet because that's always affecting you, causing dysregulation. Getting rid of the, like I say, things that are causing the dysregulation. So modulate the immune system, giving some support, things like vitamin D, glutathione, nitric balance, fish oils, things like that. And remove the stimulants, the dominant half of the immune system, and support the non-dominant half. So what we're going to talk about here is the 6 major thyroid patterns. One being the primary pituitary, secondary thyroid, primary thyroid issues, thyroid hormone conversion issues, thyroid binding globulin issues, thyroid hormone receptor site issues, and problems on the DNA itself. Like say what the hormone does is it crosses the cell barrier and connects onto the DNA. But if the DNA is having an issue, obviously that's going to cause symptoms of low thyroid as well. So we're going to jump over to the whiteboard and we'll talk about this just a little bit more. This whole system is very complicated. We're going to try to break it down so it's understandable. So you can see where you might be having an issue that might not be being addressed right now. So what you have is you have your hypothalamus, which is in the brain. What the hypothalamus does is it releases thyrotropin releasing hormone. What that does is it tells the pituitary, which is also in the brain, to release TSH, thyroid stimulating hormone. So if you have hypothyroidism, you've heard TSH a million times. Reason being is that might be the only blood test that's ever been done on you. Or maybe they'll throw in like a T4 or free T4, maybe a couple other ones. But you really need to do more extensive labs to understand what the issue is and how to correctly handle it. And that's what we're going to go into here. So thyrotropin releasing hormone to the pituitary. The pituitary gets that signal in the brain. It releases this thyroid stimulating hormone to the thyroid. So the thyroid does at that point is it releases T3 and T4. Those are both different forms of thyroid hormone. The problem being is T3 is the active form. So that's not such an issue. The issue is that when it releases these two, it releases 7% T3 and 93% T4. So at some point we have to convert this T4 into an active form, T3, in the body. So what T3 and T4 do, they jump on what's called thyroid binding globulin. And what thyroid binding globulin does is it takes T3 and T4 to different areas of the body. So without these, the T3 and T4 won't go anywhere. So the active hormone goes into the body and works like it's supposed to. What it does here is the body takes the thyroid binding globulin, puts it on the T4 goes to the liver. So in the liver, of that 93%, what your body does is it converts 60% of that into T3, the active form. It also converts 20% of that 93 into reverse T3. The reason being is you have too much T3 in your system, it'll actually kill you. So it's kind of a safety mechanism your body sets in place. And it takes that reverse T3 back up to the thyroid to be broken down. And then it also converts T4 into a form that can be converted in the gut into T3. So it does 60% T3, 20% reverse T3, and 20% of this other form that goes to the gut that can be then converted into T3 as well. So when you get these free T3s, when you get T3, it jumps on thyroid binding globulin and your body takes it where it's supposed to go. So at that point you have free T4 and free T3. What they do is they enter through the cell, they go across the cell membrane, and they actually hook onto the DNA. So what thyroid hormone does is it turns on genes and it turns off genes. So it does really, that's super important. So if you have a thyroid issue, what it's doing to you genetically is huge. Maybe not in the short term, but in the long term, absolutely. So we have all these different things. So we're going to go over 6 different issues that you could be having, causing you to have hypothyroid or Hashimoto's symptomatology, even though, let's say, your blood work looks normal. Of these 6 different areas, they can be broken down into 22 subcategories. So it gets really complicated, but we're just going to touch on some of these, and we'll cover more of the other stuff in later videos, or you can watch all this information on my long thyroid video. So the first issue that you could have is primary pituitary with secondary thyroid. So that means that there's an issue somewhere between the communication of the hypothalamus and the pituitary and releasing their hormones. Now, these are dependent on dopamine and serotonin to work correctly. So you could be having a dopamine or serotonin issue, which is causing a thyroid issue. The next one would be primary thyroidism or hypothyroidism. So that means it's an issue with your thyroid itself, where maybe your T4, like your Synthroid, or a combo like Armor T4 T3 might actually work all right for you because that's where your issue is. But as you'll see, that's one of the 6 main issues and very small of the 22 subcategories. The third being it could be a conversion issue. So if you can't convert T4 to T3, either in the liver or the gut, guess what? You're going to have an issue because you won't have as much T3 like you're supposed to, the actual active hormone. And you can have overconversion issues and you can have underconversion issues. So an overconversion issue would be that you're converting too much T4 into reverse T3, so you don't have as much active T3 this way. Or an underconversion issue like we talked about, where you just can't convert T4 in the liver or the gut into T3. Another issue you could have is on the thyroid binding globulin itself. You could either have too much thyroid binding globulin, which could be due to estrogen, male or female, or you could have too little thyroid binding globulin, which could be related to testosterone and a lot of other things too. But one thing you might not know is, your hormones can affect your thyroid hormone, which would make you look like you're hypothyroid when you really aren't. The next one could be as easy as a receptor site issue. So that'd be on the actual receptor site on the DNA itself. And those can be really 3 primary issues that can be broken down further as well. That could be cytokines, it could be stressors, and it could be cortisol. So we've talked about in other videos about cortisol and how that's a stress hormone released by the adrenal gland. So you could have a hypothyroidism because of your adrenal gland. And the last one that we'll talk about, the 6 main categories, is DNA problems. So there's an actual problem with the DNA that's causing you to have thyroid issues. So things that we're talking about there are methyl groups, and we've talked about methyl groups in the past as well. Methyl groups, as far as like the MTHFR gene, like we talked about, things that'll decrease or deplete methyl groups would be birth control, antacids, diabetes medication, antidepressants. So all these things could be a reason why your lab tests are normal, but you still feel like you're hypothyroid. And let's just look at Hashimotos. If you're Hashimotos, that's an autoimmune issue. So that's not so much, I mean, you could have stuff going on through here as well, absolutely, but that's an autoimmune issue. Your autoimmune issue needs to be supported so you have less thyroid issue. So, I mean, we could go on for days with that. So there's a lot of different things that can play into why you have hypothyroidism or the Hashimotos. So what they found, and this is, lab studies, all that kind of stuff, is if you have hypothyroidism, 90% of hypothyroid patients are autoimmune. So if you have hypothyroidism, you should probably automatically be treated as an autoimmune patient. Now, what does that mean? You need to go on chemotherapy to decrease your immune system? Absolutely not. That's crazy. What you need to do is support your body properly to decrease your immune response on itself, your autoimmunity. So there's a lot of things that go in through here, and what you really need is you need all the proper blood work done to figure out where the cogs are in the links through here. So, like I say, you probably just have had TSH or maybe T4 or free T4 or maybe a T3 added in there to make you feel special. But you really need to do all tests to figure out what the actual issue is and then how to take care of it. So that'd be TSH, that'd be free thyroxine index, total T4, free T4, T3 uptake, free T3, reverse T3, and then thyroid antibodies, which would be TPO, which is straight on the thyroid itself, or the thyroid binding globulin, like we talked about before. So this is just a taste of how complicated the thyroid can get. Like I say, if it's a conversion issue in, say, the liver, what's the medical model's, a therapy for that? They don't really have one because there isn't a medication for it. It's supporting the liver like it's supposed to detox, to pull that stuff out. It could be a diabetic issue because you have too much glycogen stored up in that liver. So we need to take care of that. We'll talk about all that stuff more in depth later. What I want you to know is there is hope. There are things that can be done. So thyroid dysfunction is a sign of metabolic dysfunction. So like we talk about, and we said it multiple times, is proper testing is crucial. No two people are the same. So if we had you come in, we'd look at the history, we'd listen to you to see actually what's going on, and then based on that, we'd do proper testing, things like complete metabolic panel, the whole thyroid panel, looking at different systems to see how they're playing off each other. Like you just saw on the whiteboard, it's not just one thing. There's multiple things in the system, and that the thing that we just talked about on the whiteboard isn't even all-encompassing. Like I say, those were the 6 main issues, but there's 22 subcategories. So figuring out specifically for you, because you're different than everybody else, what's going on so we can get you feeling better. So like I say, the blood work. We also do genetic testing to see what's going on that way, because that can absolutely affect the thyroid, is your genes. And then we can support you specifically based on your genes. So what we do is we studied both Ben Lynch and Kendall Stewart's MTHFR testing, and then Ben Lynch himself goes into a lot more genetic testing. So we look at what are called single nucleotide polymorphisms. So not just MTHFR, which plays into thyroid function, and you actually need proper T4 levels for a methylation cycle to work properly, which is huge. So if you don't have proper T4, a lot of your body systems and genes aren't working like they're supposed to, not only because they can't transcript and the thyroid hormone can't actually connect to the DNA and make turn it on and off genes, but cycles themselves can't work. So supporting you genetically to get those things working like they're supposed to. Heavy metal and mineral testing to see what's going on neurologically, because those are, heavy metals are obviously neurotoxins, and the minerals will give us good ideas as far as metabolically what's going on in your system, what you're putting out. And then let's see, what else would we do? Obviously the food sensitivity testing to see how that's playing into your immune system response. Like say, if you're hypothyroidism, there's a 90% chance, which is a huge chance, that you're also hypothyroidism, you're also autoimmune. So we need to look at that so we can get those aggravators out of your system as well. Like say we do a lot of that with the Cyrex labs, checking maybe leaky gut syndrome, gluten sensitivity. These things all play into what's going on with you. And if you haven't had these tests done, ask yourself why. Why hasn't anybody done these tests on me? Why is this the first time that I'm hearing this information, if it is the first time you're hearing it? I don't know. But this is how you can help somebody. And you need it. The definition of insanity is doing the same thing over and over again and expecting a different result. So if you've been on your Synthroid, or you've been on your arm, or you've been on your levothyroxine, and things aren't getting better, ask yourself, why do I keep doing the same thing over and over again and expecting it to be different? Find out why it's happening, and then we can actually help you. So, just a little bit more about Hashimoto's. There's kind of a triad that goes into Hashimoto's. There's antibodies for TPO, TBG, we talked about that. Gluten or some kind of food sensitivity, like say affecting the immune system, and antibodies to intrinsic factor, which leads to lower B12, which leads to pernicious anemia. So these are all big issues that we need to find out and support so you can feel better. So antibodies to TPO and TBG. So what's next? Once you have one autoimmune issue, your likelihood of getting another autoimmune issue skyrockets. So just a little bit about leaky gut, and we kind of hit on it, mentioned it at least. Leaky gut, and this is a very small example of how it works. It's a lot more complicated than this, but imagine these tight junctions in your gut. They're bound like this. What happens is you get either some kind of food allergen or some kind of hidden gut infection or whatever it may be in the system that actually opens up these bound junctions more than they're supposed to be open. So they do let certain things through. That's how you absorb food and nutrients through your system. But they open more than they're supposed to, and these things come out of your gut. Blood flow takes them to different places in the body, and then your body recognizes them as foreign because they're not supposed to be there. So what they do is they mark them with an antibody to get rid of them. But then depending on where they're at or what they might be attached to at that point or stuck to, can also attach antibodies to that structure, which could be your thyroid, which could be your liver, which could be your adrenal gland, whatever it might be. So then you now have an autoimmune issue. So yeah, peripheral neuropathy, myelin sheath, that's huge. So there's a lot that goes into it, but that's what we need to figure out so we can support you like you need to be supported. So what makes us different from every other doctor that you've seen? We manage and support our patients neurologically and metabolically. We don't just do one or the other. Both are needed to get you to feel well. If you're just doing the metabolic side or you're just doing the neurologic side, you're missing half the story. So I'm here to tell you that no stone is left unturned. We're going to do what we need to do to figure you out specifically and get you feeling better. So functional medicine, like I say, is based on findings in the lab. Nutritional products are then dispensed to support the biochemical pathways for healing. I say whether that's gut, thyroid, liver, anemia, sugar regulation, autoimmune regulation, whatever is needed for you specifically. So comprehensive neurological and metabolic workup. So these are just some neurological tests that we do and things that we can give as exercises at home. It's not, like I say, another exhaustive list. The list is huge as far as therapies that we can give for neurological, functional neurology protocols. And then metabolic tests, like I say, are just some of the tests that we do. Absolutely not all of them. So like I say, metabolic problems cause neurologic problems because remember, your energy, 30% of your energy goes to your nervous system, which is by far more than any other system in the body. So that's how you get the metabolic neurologic relation. So then you have the issues. So that's why we need to take care of both systems through there. So the 4 categories of neurological problems would be things like abnormal sensations, abnormal movement, abnormal cognition or thinking, and abnormal posture. So if you have a thyroid issue, you probably might have some abnormal sensations or definitely some abnormal cognition, from what you're used to. So 70% of the brain is a brake pedal. So weakness in one area equals increased firing in another. So that's why we do our full neuro exam to see what's happening from left to right brain. So just in a nutshell, and it's not 100% accurate, left brain controls right side of the body and right brain controls left side of the body. So we can do hemispheric testing on the cerebrum, which is the big part of the brain up through here, to see what is going on and where the decrease in the frequency of firing are happening or the increase in the frequency of firing happening. And then based on specific tests, because we know where certain input integrates into the brain, we can actually get it narrowed down to specific lobes. And at that point, we can give you exercises or things to do to increase that frequency of firing or decrease that frequency of firing to normalize the brain. And then you also have the cerebellum, which is the back part through here, that does your spatial awareness. So if you close your eyes or you start to wobble, that's a cerebellar issue. Or if you get up to go to the bathroom in the middle of the night and don't turn the lights on and you're stumbling everywhere, probably a cerebellar issue because it gives you your spatial awareness. So let's say I was close my eyes, put my hands out like this, and try to touch the tip of my nose. That's a cerebellar issue. That's a test they do when people are drunk because that's one of the areas that's affected when you become inebriated. So the two areas that need the most inhibition are the sympathetic nervous system and the limbic system. So symptoms of the sympathetic escape are things like headaches, sensitivity to light and sound, hormone imbalances, high blood pressure, poor digestion, frequent urination, poor sleep, cold hands and feet, and chronic pain. So like I say, if you have a thyroid issue, some of these are probably showing up for you, showing, yeah, you probably have a little bit of sympathetic escape also happening. So symptoms of limbic escape is irritability, lack of focus, OCD, anxiety, depression, mood swings. So typically if somebody has some limbic issues, they're kind of high emotion states. They get angry really quick or they get really sad and can cry really quick. Just high emotional states as far as that's concerned. So, and then we talked about the cerebellum and like I say, spatial awareness. So issues with cerebellar would mean clumsiness, or actually the cerebellum also does the spinal postural muscle, so you can have neck and back pain with that, or vertigo or balances issues, and visual disturbances. So what can be done? And brain-based therapy, and that's what we're talking about, using the functional neurology protocols and the unilateral adjusting to even out the brain and equalize it. So the brain is just like a muscle. It's plastic. You can work it out. So if you have decreased frequency of firing in your left brain, you can put stimulus into that left brain to increase the frequency of firing. And what they found was neuroplasticity. The brain is not the rigid object that used to think it was. They used to think once your brain was a certain way, there's no molding it, there's no fixing it. That's not true. They found that it's absolutely not true. You can increase frequency of firing. And that's why we see people with neurodegenerative disorders, MS, Parkinson's, dementia, because you can help these people increase the frequency of firing in their brain. But guess what? If they have neurological issues, they also have metabolic issues that we can help them with to take care of. Now we're not talking about curing anything, but we're talking about supporting somebody so the quality of life drastically increases and the length of their life drastically increases. So how does this happen? How do you get these stressors on the nervous system? Chemical stress, physical stress, emotional stress, all cause brain fatigue, so fewer nerve impulses. So chemical and physical stress to the brain can be things like anemia, too little oxygen, blood sugar imbalance because you need glucose for your brain. It's one of the main things that it uses. Food sensitivities like we talked about. Immune system imbalances like autoimmunity like we already talked about as well. Poor diet, which is huge in America. The standard American diet, SAD, SAD. For the very reason is it's terrible and it's affecting so many people. Anyway, you can get so much help if you just ate a good diet. Hypothyroid function, prescription and non-prescription drugs, chronic inflammation, and hidden infections. So these are metabolic problems that create nervous system imbalances, specifically in the brain. So what can be done? Well, the cerebellum and the brain require two things to function: fuel and activation. So fuel, like we talked about, glucose, proper oxygen, and then activation, brain exercises, and activation through exercise. So functional neurology treatment protocols. Like I say, these are just a few of the things that we do. Work on the balance, auditory stimulation. So when you talk about inputs to the brain, the number one input to the brain is visual. So we do a lot of visual exercises just because they activate the brain the most efficiently. And then you have auditory as a second highest activations of the brain, and then olfactory, smell. So those are things that we use a lot. And you can work those into actually physical things too, like say you want to do spin therapy, and then you can add different visual things to focus on to increase the frequency of firing to the brain, depending on what we want to actually look at and affect. Metronome, vestibular training, like say the unilateral adjusting, so we work maybe on one side of the spine or the other because we know that input's all going to cross over to the other side of the brain and activate that side of the brain. Rhythmic and timing exercises, it goes on and on. So there's a ton of things that we can do. And it's all specifically tailored to what's going on with you, because that's what's needed. So metabolic breakdown with neurological complications. So we kind of have like a big jumble in here. We have all these different things not working together. So what is our goal? Connecting the brain and misfiring so that the metabolic dysfunction stops. So like I say, getting the brain working like it's supposed to, getting the metabolic side working like it's supposed to. And then periodic retesting lets us know we're on the right track. So we always test and retest neurologically and through the lab on things that would be applicable to make sure we're making progress, not only on how you feel, but that you're actually making improvement. And then bring it all together and we have to support the whole person and you're feeling well. People come in, basically what they pay us for is to figure them out. The goal is not to have you as a patient for your life. The goal is to have you come in for a small amount of time, support your body, correct the issues that are going on, and give you the knowledge, give you the education to take care of yourself for the rest of your life so that we never have to see you again unless you have some other issue or whatever happens. But not for what you came in for, not if you're doing what we tell you explicitly through the testing. It's very specifically for you. The goal, like I say, is to get you better and get you out, live your life. Your life is not here. Your life is not at a doctor's office. I don't want to see your face a lot. We want to get you better. We want to get you out. And I mean that in the nicest way possible. So what would the first 2 visits look like? So we're going to be a complete neurological evaluation. We kind of talked about that a little bit. Review the existing labs if you have any. Absolutely bring them in so we can look at those. And we have you do paperwork as well. And we say you must be your spouse. We highly, highly recommend that you're with your spouse so they can get all this information too, so they can properly hear what's going on. Watch this video too. Have your spouse watch this video. We talk about more stuff in the office, but this is a good point you have to watch this video. And then the second visit, we do a case review, whether we accept your case or not. We don't accept every case. If we can't help you, we're not going to have you come in. That doesn't make any sense. If we can help you, absolutely, we're going to try to get you to come in because we can make a difference for you. We'll overview the further complete testing to be done, review of the neurological findings from visit 1, overview of the treatment plan. That would be for you specifically, a review of the financial obligation, and we say must be with your spouse. On the second day, on the second visit, we kind of expect you to make a decision whether you want to come into the office or not. And we need your spouse present so you can make that decision together. So what else do you need for your first appointment? Well, we highly recommend bring shorts and a shirt just so we can do the proper neurological testing that we need to do that first day. You have to have all your paperwork filled out. There's too much paperwork that you can't sit out in the office and try to fill it out before your appointment because it just won't work. We do extensive paperwork because we want to figure out what's going on with you specifically, and it's all related. So you'll get the paperwork and you say, holy smokes. And it's kind of a weed out process. If you're not dedicated to your health enough to fill out a few pages of paperwork and have them done for your appointment, you're probably not a good candidate for care, because we want people that want to get better. And if you can't even do those things, then you don't want to get better enough to be a patient, in my opinion. And I say bring your spouse so we can talk, so we can everybody be on the same page of what's going on. So commitment / insurance. Everybody wants to know this. This is the big question. Doc, how much is it going to cost? I don't know. It depends on the case. It depends how complicated it is. It depends what tests we need to do. So there's 3 rules for acceptance of the case. 1, you must be willing to make serious life changes. Because some things are going to tell you. Say, hey, Julie, you need to not eat corn because it's going to absolutely affect your thyroid function. You're going to feel terrible every time you eat it because it's causing your immune system to attack itself, causing all these other issues, causing your thyroid symptomology. And if you don't listen to me telling you not to eat corn, or whatever we find on the testing, guess what's going to happen? You're going to continue to have your symptoms. So you have to be willing to make serious life changes, dietary and otherwise. You have to take accountability for your health. It's your health. What's more important than your health? Your cell phone, your car, your house. You get a really bad patient, a really bad thyroid issue. They can't even leave their house. So what does all this stuff do good for them? What is, say you have kids or grandkids, you can't do anything with them because you can't get the energy. You feel so terrible. What's more important than your health and being able to do what you want to do and enjoy life? I don't know. But you have to take accountability for that. So if you're smoking 3 packs a day, Take accountability for your health. That needs to be changed if you want to get healthy. Let's be honest, okay? I'll be honest with you, you be honest with me. That is needed, okay? And there'll be other things, we'll talk about it. That's why we have you do the paperwork, so we can find these things out, so we can have a conversation, so we can be on the same page. And number 3, insurance/Medicare only pays for a small portion of this care, if any. What you'll find is medical doctors, the allopathic model, you go over to the hospital, they're great at acute care. They drop the ball on chronic conditions like thyroid, fibromyalgia, neuropathy, whatever it is. They drop the ball, okay? And your insurance doesn't care. So if you want good care for a chronic issue, you're probably going to have to pay at least a little bit. All honesty up front. So we've made our care plans affordable so that 96% of people that come to see us can get care that they need. So typically, and this is a ballpark, typically that can be from $200 to $400 a month for up to 18 months. So once again, I'd say that's like a cell phone payment. That's your dish TV. That's, there's a lot of different things. But what's more important than your health? So that's what we're talking about when we go through that. So on a scale from 1 to 10, how serious is your illness? These are questions you got to ask yourself. How has it affected your relationships, your work, your ability to enjoy life? On a scale of 1 to 10, how serious are you about eliminating your illness? So due to time constraints, we can only accept so many patients. That's why we really try to find the ones that are truly committed to getting better. We're all about success stories. So if we can give you as much information as possible so you can make a good decision for you and your health, and then you can understand why we're doing what we're doing, we're going to be on the same page. We're going to have a success story. But if you don't want to be here, you're not willing to make the changes, it's not going to be a good deal. We want success stories. We want people who are dedicated and willing to change, do whatever it takes to get healthy and stay healthy. If you are breathing, you can get healthy. I promise. You can do things to improve your health. You can improve the quality of your life. And I can't do everything for you. You have to want to too. So in closing, my name is Dr. Taylor Van Weinboom. And we just want to help you. That's what we're here for. Whether it's thyroid, whether it's fibromyalgia, whether it's IBS and autoimmune conditions, whatever it is, we are here to help. So thank you for watching our video. Here's some of our information here if you want to contact us or get a hold of the office.